Good morning, student. This is Jyoti Pandey. Teach you the subject pharmaceutics. So, the Unit 1 topic is Introduction about dosage form. This topic includes definition of dosage form, drug definition, and about pharmaceutics. It also includes about the requirement of dosage form, that means why we need to administer the dosage form in the body, route by which we administer the drug, and different dosage form, that means its classification. So let's start with definition of subject, that is pharmaceutics. So what is pharmaceutics? Pharmaceutics is a branch of science that deals with the collection, compounding, preparation, manufacturing, dispensing, and labeling of drug and active pharmaceutical components. So here is a term which is comes in a definition pharmaceutics, that is drug. So what is drug? Drug is a chemical substance that is used for diagnosis, prevention and treatment of any disease in a human and animals. What does the diagnosis term means? Diagnosis means journal examination which is done by pathological testing like blood test, urine test, etc. Next is prevention. Prevention means prior protection, which is done by the using vaccination in the body. Third one is treatment. Treatment means medication and the therapy. So these are the measures by which we can protect ourselves from the disease. We can treat disease infections inside the body. Next term is dosage form. What are dosage form? Drug, which is a chemical substance, when it's administered in the body, it cannot be administered in its original form. It is administered after converting into a different forms, and these different forms are known as dosage form. So dosage forms divided into a different subcategories like solid, liquid, semi-solid, and gases or parenteral dosage form. Why we need of these dosage form to administer in the body? So what are the requirements? We require to administer this dosage form for the accurate dosing. Number two, for protection of drug from the gastric juice. Number third, masking bitter taste and odor. Number fourth, placement of drug within body tissues. Number fifth, for the sustained release action, that means a slow releasing action. Number fourth, controlled release medication, that means release of medication in a controlled and predetermined period of time. Next is optimal drug action, that means drug action as per our desired requirement. Next, insertion of drug in the body cavity. So by using the different dosage form, we can administer the drug in a different body parts. Next is use of desired vehicle for insoluble drugs. Some of the drugs which are not solubilized in the body. So these drugs, after converting into a various dosage form, easily administered in the body. So these are the advantage of dosage form, and by these following these advantages, we can administer the drug easily in the body. Next is routes of drug administration. We can administer the drug by various routes like oral. Oral includes sublingual and buccal cavity. Next is parenteral. Third route is intraocular, that means inside the eye. Next is intraoral, that means inside the ear. Next is intranasal or intrarespiratory, that means through inhalation via the nose or oral cavity. So different dosage forms can be easily administered by the different routes. Some of dosage form administered by the topical section, that means via skin, by spreading, by syringe, by in the form of patches. So these are the different routes of drug administrations. Here is a small diagram by which we can understand the route of drug administration, like oral route. We can administer syrup, tablet, capsules. By inhalational route, the doses from inhalers and aerosols can be administered by inhalational route. Nasal route, nasal spray, nasal inhalers. Such doses form administered by this route. Intravenous route is a parenteral route. In this route, drug directly goes into the systemic circulation and drug administered with the help of syringe. Intraocular, that means into the eye cavity. Transdermal, that means dermis means skin. So such uh, doses form administered via topical skin, for example transdermal patches. These are oral route, that means in the mouth cavity, and next is sublingual route. Sublingual route under the tongue. When we placing any tablet, capsules, lozenges under the tongue, this is sublingual route. And buccal route is a route which is in which drug administered in between of cheeks and gum section, in between of cheeks and gum section. This is a cheek pouch. So cheek pouch section, this route is known as buccal route. So these are the different routes of drug administration. Now goes to the classification of drug. Dosage form. Types of dosage forms: solid, liquid, semi-solid, and other route like gases and parenteral. Solid dosage form include unit and bulk dosage form. Unit, for example, countable dosage form, tablet and capsule. These dosage form easily countable in a single dose like tablet, capsule, one tablet, one capsule, two tablet, two pills, etc. Bulk doses form, these are non-countable but measurable. For example, powders, nutraceuticals, dusting powders, uh, nutrient supplements powder. These are measurable doses form like 1 teaspoon, 2 gram, 5 gram, 5 ml. Likewise. Next is semi-solid dosage form. Semi-solid dosage form include cream, paste, gels, and suppository. Suppository used in rectal or vaginal site, male and female. Third category is liquid dosage form. Liquid dosage form includes two subdivisions, monophasic and biphasic. Monophasic means single phase system, that means one layer system. These dosage form also known as true solutions, for example, syrup, solutions, elixirs, mouthwash, and use on skin, lotions, liniments, etc. Biphasic means two layer system or two phase system, like one, and both phases are immiscible to each other, like oil and water. For example, emulsion preparation and suspension preparation. Fourth one is gaseous dosage form. Gaseous dosage form include inhalers and aerosol. So this is all about the drug and its dosage form. So what we studied in today's lecture, we study about the drug and their dosage form. So drug is a chemical substance which is used for disease treatment, disease diagnosis and prevention. What are dosage form? Drugs converted forms are known as dosage form. Types of dosage form is solid, liquid, semi-solid. and gases or other is parenteral. Routes through which we administer the drugs are oral, parenteral, topical, and other routes like rectal, vaginal, urethral, ophthalmic, nasal, etc. So, we can use the following references for further study of topic introduction of dosage form. So, thank you so much, student. This is all about the drug and its dosage form. Thank you once again.